morning, Senator Durazo. I'm Joy Garbida from the Office of the Expand NP Scope Project. Thank you for sparing some time with me today to discuss my advocacy.
Good morning. It is my pleasure to see you today. How can I help you?
I am a nurse practitioner working in a privately owned clinic in Indio, California. I work in collaboration with the physician and I provide primary care services to about 1,000 patients. Since the enactment of the Affordable Care Act and subsequently expanding Medi-Cal program, our clinic has been inundated with patients leading to long wait lists and long wait times.
Oh, what have you done to manage the influx of patients?
The office administrator has posted a full-time physician position, but so far there are no takers. Most of the physicians that I know have full-time jobs. We have some NPs and physician assistants that are willing to step up and run their own clinic, but to do so, they will need a physician to supervise their practice. Since we could not find a physician willing to supervise, they cannot proceed with their plans. That's why I'm here today to ask your help to assist with Assembly Bill 890. AB 890 was recently approved by the General Assembly on January 27, 2020. The bill is now under the Appropriations Committee that you are part of. If the bill is approved by the Senate, it could alleviate some of the supply gap for primary care providers in our state.
Oh, District 24 is having the same access issue as you do right now. We have expanded medical and have increased the number of covered people by more than 4 million from 2013 to 2018. How short will the supply be moving forward?
In a study conducted to project the primary care supply and demand in California, it was found that there is a projected shortage of 4,138 primary care clinicians in 2030. Shortage was attributed to inadequate number of newly licensed physicians to replace retiring physicians, which will decrease physician supply by 30%. Meanwhile, the NP workforce is projected to grow faster than the physician supply. NP supply is projected to increase by 82 to 152% in 2030. NPs are more likely to work in inner cities like yours and in rural areas. If the rapidly growing NP supply can be effectively integrated, then the primary care provider shortage will be partly alleviated.
That's a great solution, but I had a meeting with the American Medical Association and they have strongly opposed the expansion of the nurse practitioner's role due to quality of care and provider training and education.
Well, as to the education question, AB 890, when it gets approved, will require additional education and certifications before nurse practitioners can assume more treatment authority and more training for those who want to set up their own clinic. As to patient outcomes, in a study that compares patient outcomes between primary care physicians and NPs in a 6-month follow-up study and a 2-year follow-up study, there was no difference in patient outcomes. Patient outcomes were measured based on health status, satisfaction, or use of specialists, emergency room or inpatient services, and disease-specific measures for hypertension, diabetes, and asthma. As for patient satisfaction, in a survey of more than 1 million veterans under the Veterans Health Administration, there was a 5% increase in patient satisfaction when they hired more NPs to provide care services. In 2016, by the way, the VHA granted federal full practice authority to NPs. And so if NPs practice with FPA, there is predicted increase in preventative care visits, increased access, and state savings of about 800 million.
Oh, well done. I will look into this bill when it gets on my table.
Thank you for your time, Senator. Please be the voice of millions of Californians waiting to be seen by a primary care provider. Here are some of my business cards in case you need my assistance. You and your staff can call or email me anytime.
You're welcome. It's my pleasure to have you today.